I think, Sarah, you can take it away whenever you're ready.
All right. Hello, everyone. My name is Sarah. I'm the program assistant at the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. We're very excited to present to you the second session of classroom-wise implementation support planning for school mental health leaders. If you have audio or technical issues during the session, the chat box is open for you to communicate with our team so that we may assist you. Also, if you have a link to resources you'd like to share with other attendees or any questions for the presenters, please enter those into the chat as well. Also, we really encourage you to keep your videos on if you're able to, just to get a little face-to-face communication, engagement, and everything. But today's session is brought to you by the Southeast Mental Health Technology Transfer Center, or MHTTC for short. We are located in Atlanta, Georgia at the Emory University Rollins School of Public Health. We are proud to serve the 8 states of the HHS Region 4 that you see pictured here. Our center includes faculty and staff and expertise in public health programs, finance, policy, and health systems, which provide us with a unique lens through which we can address mental health priorities in our region. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to the region. And just a quick disclaimer, the presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, SAMHSA. The opinions expressed in this learning session are the views of our moderator and panelists and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. I'm now very happy to introduce Dr. Elizabeth Connors. She is an assistant professor at Yale University Division of Prevention and Community Research and at the Child Study Center. She is also a faculty member with the University of Maryland National Center for School Mental Health, where she is the Director of Quality Improvement and a developer of the SHAPE program. Dr. Connors received her PhD in clinical child and community psychology, and her work focuses on improving access to high-quality mental health promotion, prevention, and intervention services and supports for underserved children, adolescents, young adults, and their families in critical access points such as schools and community settings. Also, if Jessica Gonzalez is here, I'm not sure, but we would like to give her a little acknowledgement. She's from the Network Coordinating Office, and she helped with the development of the Classroom-Wise course, and also is the voice of the Classroom-Wise module. So I'd like to hand it over to Dr. Connors.
Thank you so much, Sarah. We're so thrilled to have another office hours with you all about this exciting resource. The goal for today is really to increase your understanding of Classroom-Wise modules 1 and 2 structure and content. However, before we dive into modules 1 and 2, I do have a few intro slides about Classroom-Wise generally, because you may have missed our first office hours, or maybe this is still a new resource that you're trying to really get your arms around and understand how to access it. So we are going to start out with a little bit of info on where to find Classroom-Wise materials, but then we're really going to dive into modules 1 and 2. And the goal is to really do a recap so that you have kind of a peek inside what is contained in module 1 and 2, and then we're going to talk a little bit about some best practices to effectively support Classroom-Wise adoption and implementation in your local schools. So we'll have some discussion questions throughout and some time for you to pause and reflect and share with one another how the specific content of these modules may be aligned with priorities in your schools or existing initiatives that sound similar. So you can really think through, if you were to adopt Classroom-Wise and elements of this package, how would these particular modules align? We are always here to promote cross-state networking and shared learning about best practices. So we really do hope for this to be a very participatory session. And then at the end of the talk, We do have the upcoming office hours dates and times. There are several more office hours in this series about ClassroomWise that are scheduled for this summer. Next week, we're going to be diving into Module 3, which is on social emotional learning, and really talking about how that module may intersect with other work that you have. And then the upcoming office hours will focus on Modules 4 and 5, and then 6, and then we have a final office hours at the end of the summer. So we welcome you to join us for any of the ClassroomWise office hours that are scheduled this summer to really get to know this resource and think through how it may be very relevant in your schools. But first, we do want to take a pause and make sure that we are welcoming everybody that is here with us today. Several of you have already introduced yourselves into the chat. So if you've not done that yet, please do so. Type in the chat your name, your organization, and your state so we know where you're coming from. If you're coming from a local district or school, we would love to know that information as well. We also know that on these calls, sometimes there are folks that join us from outside the Southeast region, which is really exciting. So wherever you are joining us from, we are so glad to have you, and we look forward to seeing those intros coming into the chat so we can see who is on with us today. Okay, so I want to start out with just a little bit of a recap about ClassroomWise, and even for those of you who have a sense of what ClassroomWise is already, a little repetition never hurts any of us adult learners, right? Because this was a resource that was just released a month ago. It's brand new to the field. So this is a free, in the public domain, free 3-part training package. It offers evidence-based strategies and skills to engage and support students with mental health concerns in the classroom. There are also a number of strategies and skills in here for students who are not evidencing any mental health risk, but rather we want to promote their continued well-being and their resilience and their strengths. There is a 5-hour self-paced online course that's part of this package. There's also a video library and resource collection where you can go directly to any of the videos or resources that are embedded in the online course. You can just access them right there. And this is all housed on the ClassroomWise website. So if you go to classroomwise.org, that is the website that I'm referring to right now, where you're going to find this 3-part training package. This resource was developed by the Mental Health Technology Transfer Center Network in partnership with the National Center for School Mental Health at the University of Maryland. There is an introduction video here that I encourage you to check out when you get a moment. It's right on the homepage. It's 6 minutes long, and I encourage you to check that out. This is a great way to share ClassroomWise with your colleagues. If you're really interested in this resource and you need to bring it to other decision makers or leaders in your systems, this is a great thing to just press play and they can get the overview, a lot of information that they need to know about how ClassroomWise was developed, for whom, why, and what it contains. So please be aware that that is on the ClassroomWise homepage. So let's start by talking a little bit about the ClassroomWise online course. This is a 6-module self-paced course, and the goal here is really to equip your educators with information and specific actual strategies that they can use in their classroom to more effectively promote mental health and well-being of students. So it's not just informational in terms of increasing knowledge, but there are practical skills and examples provided. So it is very concrete and gives teachers ideas of things that they can integrate into their daily or weekly routines in their classroom. So it's designed to be very practical. The first 3 modules really focus on promoting mental health and well-being of all students. So this includes topics like creating safe and supportive classrooms, teaching mental health literacy and reducing stigma. Those are the 2 we're going to dive into today, as well as social emotional learning. Modules 4 through 6 look at understanding and supporting students who are experiencing adversity and distress. So understanding and supporting students who are experiencing those things, understanding the impact of trauma and adversity on learning and behavior. And one of my personal favorites is Module 6, which has real concrete strategies to support students experiencing distress. So one of the ways that you could think about these modules is that modules 1, 2, and 3 really represent skills and strategies and knowledge that you can use at the universal Tier 1 promotion and prevention level for all of your students. Modules 4 through 6 are going to give more strategies for those students who are at risk for developing mental health needs or may have experienced some stress or adversity. You know, maybe those students could benefit from sort of some Tier 2 early intervention or treatment services and supports. So that can be a good way to kind of think about modules 1 through 3 versus 4 through 6 in terms of content. There is a detailed list of all module objectives that you can grab right on the website, and the link for that is at the bottom here, the PDF link. So we want to be real clear about how you take the ClassroomWise course. It's pretty easy, but we just wanted to provide a few screenshots so that you have some baseline familiarity with it. What you do is you go to classroomwise.org and you click Launch Course in the upper right-hand corner. It's pretty intuitive. You're then going to be navigated to a separate website that's called Healthy Knowledge. This is a website where there's a lot of free online training courses that are funded by SAMHSA and the MHTTC. So the Healthy Knowledge site is actually where the course content and the modules live that you access. Once you get to the Healthy Knowledge site, you select View Course Description and you enroll for the ClassroomWise course listing. It'll then ask you to register if you haven't already, or you'll have an option to log in, and you can create an account if you don't have one at that point. And then this is what the landing page looks like. It's pretty clear when you get there, and it's clear kind of how to get started with the introduction and first module. Here are a few details about the course that you might be wondering about already. So it is narrated. You'll need speakers or sound enabled, or you can choose to use closed captions if you don't have sound or if there's a hearing impairment. There's also a full transcript of each module that you can download at any point. So whether or not you took, for example, module 2, you could create a login to Healthy Knowledge right now and go grab that transcript for module 2. So the transcripts are really a nice resource. This could be helpful for any school or district leader who's interested in seeing what's sort of contained in the module without going through the whole self-paced course, if that makes sense. The 6 modules do need to be taken in sequence. So you've got to pass the quiz with 80% completion to advance to the next module. A certificate of completion for 5 contact hours is available after the course is completed, and there's a really nice certificate printout that you can access after everything's completed. So there's 6 modules, but it is estimated to take about 5 hours to get through the 6 modules. Anybody can log in and take this course. We've gotten some questions about this already. Folks saying things like, I consult with schools, but I don't work directly in a school. Is it okay for me to log in? Absolutely. This is a material in the public domain. Family members, parents are welcome to go in and take this. Your secondary students may want to go in and take this. Somebody that's just curious about what it is. We often have a lot of folks on these calls who are in leadership positions and want to make sure that they have a really clear sense of the resource or material before they, take the next steps to really promoting it and supporting it for adoption. So please feel free to log in and access it, even if you're not an educator. On the ClassroomWise website at classroomwise.org is where you can access the video library, which contains all of the videos that are embedded in the ClassroomWise online course. And you can also get to the resource collection. These are awesome resources to have at your fingertips. It basically takes all of these incredible resources embedded in the course and puts it on the ClassroomWise website, so you can just grab it and hit play in terms of the videos, or you can just pull the resource and download. So if you're interested in some of these goodies that are embedded within the course, please visit the video library and the resource collection to just access them directly. Okay, so that's a little bit about ClassroomWise overall. Before I dive into modules 1 and 2, I just want to check the chat and also see if there are any questions that have come through about classroom-wise generally that we might need to address right now. Feel free to unmute and ask aloud or type in the chat if you have any general classroom-wise questions, how to access it, who it's for, anything like that. Okay, and our team will be keeping an eye on the chat throughout, so if there are things that come up for you that you have questions, feel free to just put them right in. So there are contact hours available. There's 5 contact hours that you'll receive. I'm not sure how that intersects with specific CEUs, but I'm wondering, Jessica, if you're on, Jessica Gonzalez, can you tell us the distinction between the contact hours and the CEUs? You might know a little bit more about that. Let me go back there.
Yeah, so we do offer a certificate of completion once the entire course is completed, and the quizzes obviously are passed with that 80% score. We currently do not offer CEUs. We did look into that as a network and with the National Center for School Mental Health, and found that it's, you know, a little difficult given the different state requirements for various school mental health provider roles. And so I think that in this next year of funding with the MHTTC network, it's definitely something we're looking into working on with our regional centers so that each state can find a way to possibly offer CEUs. It'll vary, of course, across states, but that is something that we're hoping to work on in this next funding year. But right now we do offer those 5 contact hours. You do get that certificate of completion. And we do know that some districts, you know, do require professional development for educators and school mental health providers. And so the certificate of completion is something that they can show as proof of that professional development and can count at least towards that. But at this time, officially, no CEUs are being given for the course.
Thank you, Jessica. I think that's super clear, and it makes a lot of sense because the specifications around how to obtain CEUs for the wide variety of professionals that we have in schools does get pretty complex, especially when you're talking about a number of different professions and across state lines. But it sounds to me that if you do have a requirement for your teachers to take this or your mental health professionals to take this, and they can turn it in for some sort of credit or proof of completion, that the certificate of completion could be used in that way. Great question. Please keep the questions coming as they come up. And thanks, Jessica, also for being on. So we're going to dive into modules 1 and 2 a little bit. What we have prepared is about 6 slides on each module. I'm going to share with you what module 1 contains, and then we're going to take a pause, and I'd like you to reflect on how this aligns with priorities in your school buildings or other initiatives in your school buildings. And we're going to do the same thing for module 2. Okay, so module 1 is focused on creating safe and supportive classrooms. The module introduces the 3 components necessary for creating safe and supportive classrooms. So engagement refers to feelings of connection, a sense of belonging with a larger group that requires positive relationships and connections. Safety refers to the need for a sense of security and protection. And environment refers to the physical and instructional environment of the classroom. And the module looks at each of these 3 components. This module also really highlights strategies to help students feel engaged and safe in the classroom and help teachers design safe and supportive classroom environments. These strategies are discussed by teachers and students in the videos in the module as well, which we're going to see a video. So these terms and concepts may be familiar to you. You may call them different things in your school buildings. You may be referring to them as school climate, for example, or trauma sensitive. There's a lot of different terms that schools will use to refer to different ways that they create safe and supportive and resilient classroom environments. So there are a number of strategies to help students feel engaged in the classroom community that's overviewed in this module. The first one is welcoming students. So simple things like greeting with a smile or addressing students by name. I'm going to show you a video in a moment with some recommendations about that, as well as learning and incorporating student interests. So incorporating students' cultural background, interests, sports interests, using student inventories to learn about students at the beginning of the year. The third one is just being available for students. So showing students how much you care through active listening. There's an example for elementary and secondary active listening in the course, and using positive language. So modeling positive thinking, using behavior-specific praise, and there are a number of ways shared to do that. The module really emphasizes that relationships are the foundation of engagement, underscoring that the positive interactions and those strong student-teacher relationships can help students feel included, safe, supported, connected, and ultimately can mitigate the impact of stress and adversity hugely. So if you've got, teachers taking this module who are already doing a great job in all these areas or most of these areas, this is going to reinforce that they're on the right track and they're already doing so much to help their students feel safe and supported. If you've got some teachers who are maybe doing one or two of these things, it's going to remind them how important these things in the classroom environment that sometimes can just feel like something small, like greeting a student with a smile, really does make a big difference. So that's what this module is intended to get at, and really remind teachers that the work that they put in to building the relationships and being intentional about welcoming their students and getting to know their students makes a really big impact on mental health and well-being. So I'm going to show you this video, and I'm going to optimize my share, which I think will help with the sound. Can you all still see my screen?
Yes.
Yes? Okay, great. I'm going to go ahead and hit play on this.
Some of the things that made the students in the classroom feel most welcome and included would be when the teacher just had a good attitude. I think when teachers come in happy and inviting to their students, it just makes the day a lot easier. Students probably feel more comfortable talking to teachers when they can tell that they're also in a good mood.
I think the most important thing is when a student walks in. I know my teachers in the past, they'll call you by name. They'll be like, "How's your day?" That just makes me feel more important.
You get on a personal level with your teachers. They come, they ask you about your day, they ask you how yesterday was. Say you had a practice the other day, they're asking you how you did. They're asking you how's everything going. It's not just like a teacher relationship. They're not only teaching you, they're there to be almost as a friend to you.
I love a teacher that is very welcoming and excited, that's very passionate about their work.
What makes me feel welcome in a classroom is that they give me a big warm smile. They ask me about my weekend. That's what makes me feel welcome.
Okay, I'm gonna look and see if you guys can let me know in the chat how the audio was for that. I would really appreciate it. I hope you could hear that. It was just a little bit over a minute video clip, and that's an example of one of the videos that's embedded in Module 1. Great, thanks for the feedback, everybody. So the strategies, there's also a number of strategies that are discussed for creating safe and supportive classroom environments that go beyond some of the ones that I just mentioned. So there is attention to discussing how physical space and layout can create a sense of normalcy and routine. Having distinct areas in the classroom can help students know what to expect. So there's discussions of things like calm down corners, having an organized classroom, just to really give some examples, and there's some images and things about how physical space and layout can provide a safe and supportive classroom environment. There's also attention to the importance of routines, so that consistency really helps provide all of us, I think adults and students alike, have a sense of security, decreases the likelihood of challenging classroom behaviors. So as many predictable routines as can be put in place on a daily basis, that's going to be very helpful. And that kind of goes hand in hand with having established rules, classroom rules that clarify expectations of students' behavior and how they interact with one another and with the adults in the classroom. There is a real emphasis in the module on collaborating with students to create the rules so that they are really active in the creation of that. And there's some videos on how to review rules and routines with secondary and primary students. So that's a little bit about what's on the inside of Module 1. So I'd like to just take a moment here and get your feedback. You're welcome to unmute and share aloud or type in the chat. How does ClassroomWise Module 1 align with priorities or existing initiatives in your schools after we've talked about some of that content? So I'm curious, for example, is this content an area of need that you're interested in prioritizing and would welcome more training on? Is it something you've been doing a lot of work in and maybe have a good stronghold in this area and this could add to it? Is it parallel with some other work like focus on school climate or trauma-sensitive classrooms? I know so many of the things that we just talked about were very disrupted this past school year with COVID and a number of school closures and hybrid learning. In many ways, these ways of staying connected are very much endogenous to the in-person learning environment. So there's been a lot of disruptions to these sorts of activities to create a safe and supportive classroom environment. Great. So I see some ideas coming through the chat. Ashley says that the teachers make sure to greet the students every day and give high fives or little dances with the students, and that it helps them feel welcome. And she's going to be working on them with being trauma informed. That's outstanding. So again, if you've got teachers that have some of these rituals and routines, I think by viewing this module, it will reinforce how important those practices are that they're doing on a regular basis. Judith says that it aligns with their universal PBIS approaches, interconnected system framework, and MTSS Tier 1 interventions. Great that you're trying to align for all of your schools. Beth says that in their state, they are focusing on mental health in the schools. So this could be a good program for the districts. Absolutely. So if you're interested in figuring out how you can provide more training for your teachers and your school staff on mental health and well-being and how to really be there for the students in ways that are consistent with their training. You know, we're not asking teachers to be mental health providers, but we're equipping them with some knowledge and some basic strategies that they can do in their day-to-day that really promotes the mental health and well-being of students and that resilience. So these are, you know, these 6 modules are really designed in that realm. So if you're looking to just infuse a little bit of mental health training and strategies into your system, and that's really a focus, this could be a really good fit. Roberta said they're focused on connecting youth to the school. The youth survey showed that the youth don't feel very connected to school and don't feel like their voice is heard, and Module 1 here could really set the foundation. Students need to feel safe and supportive in order to connect with people like their clubs or sports. Absolutely. And shout out to Roberta and her team for collecting a youth survey and understanding that that is a current need among your student bodies. So I would encourage you, if you have data in your systems that indicate that there are some issues here in terms of students or staff feeling connected, feeling supported, feeling emotionally safe, that after you put in place something like ClassroomWise would be a great time to reassess and check back on that, you know, midway through the school year and see if there's been an opportunity to move the needle on that and help bolster some of the connectedness in your school communities. Great question from Bob about mental health first aid. Bob, I have a slide coming up for you soon, all about mental health first aid right after module 2, because that is going to be the most aligned with youth mental health first aid. So I promise we're going to chat about that. Great question, but I'm just going to put a pin in that one until we get there. It looks like June's work does focus on creating safe and caring environments as a foundation as it pertains to comprehensive bullying prevention. Absolutely. So you may have some problem-specific or need-specific priorities like bullying prevention, right? That putting in place something like this at the universal level is going to prevent some of those things bubbling up. And so that's a perfect way to think about this. And if you're in a locale, for example, where bullying prevention is a big priority and it's something people are talking about, I think it's very appropriate to message classroom-wise as something that can help with that. So helping people in your teams and in your system, seeing this as a resource that can align with and bolster your existing efforts, not we're bringing in a brand new thing, right? But rather this can help us with kind of what we're doing at the tier 1 level to try to get after some of those other issues. And I wasn't familiar with Kentucky's requirement, Miriam, that every school has a trauma team and every district has a trauma plan. That is amazing. They're recommended elements, but obviously there's some heterogeneity across different locales, which we always expect, right? So some ways to institutionalize these approaches so that it's part of a routine way education happens. Absolutely. So if you've got something like trauma-sensitive schooling or classrooms, or school climate, that's kind of a really big, broad initiative that all schools or districts in a state is trying to do, but you feel like there might be some gaps in implementation or some locales that could use some additional supports. You know, introducing them to Classroom-Wise as a free resource could be a great way to kind of get them on the path of shoring up some of that consistency in the work they're doing. And I love to see that as part of the School Safety and Resiliency Act. Yes, so if you have other policies that you all are working under right now, like the School Safety and Resiliency Act or other things in your states, I think aligning Classroom-Wise and messaging it as part of those policies that are already in place is very wise. So you're kind of like creating your elevator pitch right now, right? So like, here's how you talk about Classroom-Wise to your colleagues and how it can align with things that are already a priority to you there locally. Excellent, thanks for everyone's feedback. So we're gonna open that up again after module 2. So let's talk for a couple minutes here about module 2. This module covers how to teach mental health literacy and reduce stigma associated with mental illness. It reviews how to provide accurate information about mental health, particularly some examples with how to do that with students. If you hear some language from students that may indicate some inaccurate knowledge about mental health, what teachers can kind of do in the moment to intervene on that and correct that, how to talk openly about emotions in the classroom, to be really careful and intentional with our own language as adults, but also noticing that in others, and really incorporating the lived experience of those with mental illness to help raise awareness and empathy around these issues. So just a quick recap on these definitions, which are contained in the modules. Mental health literacy is knowledge, right? So mental health literacy is knowledge of mental health and mental illness. And with that knowledge, we are then aided in promoting the well-being and the prevention, identification, and intervention of mental illness and other mental health problems. So mental health literacy is like knowing that mental health is a concern, that everybody has mental health, and that mental illness does impact, you know, approximately 20% of people, and just recognizing sort of the prevalence of mental health needs in the community. Mental health stigma is a little bit different. These are a set of beliefs or negative attitudes about mental illness that can cause the public to stereotype and reject those living with mental illness. So the goal here is to increase the mental health literacy of our communities by simultaneously decreasing the stigma associated with having a mental illness. And so when we promote mental health literacy in the classroom, that is our way to combat stigma. So if you're in a community that you feel like there is a lot of stigma around people with mental illness or help seeking or what that means to seek counseling, providing more mental health literacy training is going to be the best tool in your toolbox to take on some of those beliefs and negative attitudes. So this module starts with an overview of the mental health literacy components. Mental health literacy, of course, we talked about it as knowledge. And so the first component is really obtaining and maintaining complete mental health and helping teachers understand that when we're talking about mental health, we're not just talking about mental illness, but we're also talking about well-being and the ability to function across other areas of our lives, as well as strength and thriving. So yes, we could think about mental illness as a component of mental health, but that's really only kind of one small piece of complete mental health. There's also a focus on understanding and addressing mental health problems and disorders, enhancing help-seeking skills, and as I mentioned, decreasing stigma. Here are some strategies for introducing mental health literacy to students. So designing activities around defining mental health, what it is, what it isn't, with again, that focus on kind of complete mental health. So it should be complete mental health is the absence of mental illness, but also the presence of well-being and indicators of strength and personal thriving. You could also practice stress management and healthy coping. So there are concrete strategies contained in this module that teachers can support students with, like using daily mindfulness messages, engaging in positive self-talk, both modeling that, but also teaching and prompting that for students, and guided breathing or stretching, brain breaks, things like that, as well as making sure that students understand who is available to them in the school and in the community to help. We know sometimes the biggest issue is that if people identify they're having a lot of stress or they're starting to experience some tough times, they don't know who to reach out to, they don't know where to start. So really making sure that students know about that, but also teachers know about that, so we can build that bridge to access to supports when needed. So here are some additional strategies for increasing mental health literacy in the classroom. These are even more kind of concrete. So providing accurate information about mental health, like discussing mental health facts, addressing misconceptions. You know, and teachers are in the position to sort of hear these things off the cuff that students say in the course of the school day, right? So they are in a perfect place when they hear that to kind of just catch it and turn it around a little bit and make sure that there's some correction of misconceptions. So they're very important in that process. Also talking openly about emotions, having regular conversations about feelings with students, being very careful and intentional with language, so choosing words carefully, incorporating lived experiences when it makes sense. I think an example that's contained in the module is discussing celebrities who are living with mental illness and ways in which they're thriving and coping with that. And just raising awareness generally. I know many of you in your schools probably have mental health awareness campaigns, or maybe you have student groups that are focused on mental health literacy and awareness. But any of those types of activities are going to be very helpful in this realm. Again, the module really emphasizes the role of teachers and how well-positioned teachers are to increase understanding and shape students' attitudes about mental health. And it can really enhance the likelihood that students will obtain and maintain kind of their well-being, that they're going to be able to seek help when they need and support others when experiencing distress. So the message here to teachers is like, you are a huge gatekeeper and a big piece of this puzzle, and there's so much that you can do directly with students. So it's very important that teachers hear that message and they know that their role is so critical in that way, because there's very much that they can do. So let's look at this clip about addressing stigmatizing language.
Stigmatizing language is infused in much of our culture, so students may use it without recognizing its impact. Here's an example of how you can help students replace stigmatizing language.
All right, let's talk a little bit about the character that we just read about. What did you notice about her? Will.
I thought she was acting a little bit crazy.
All right, guys. Well, crazy is a word that can be stigmatizing and hurt people. What's something else we could say about her instead of using the word crazy? What do you think? How else could you describe what was going on with her?
Well, I mean, she wasn't really making any sense, so like unpredictable.
Unpredictable, great word. I like how you mentioned that. So what made her unpredictable? Max.
Well, she left home without telling anybody, and she didn't even come back to work.
Okay, so you're right. That is unusual behavior. That was unpredictable for her, but has nothing to do with her mental health.
This can feel like a challenging conversation to have with students, but helping to replace stigmatizing language can make all students feel safe and welcome in your classroom.
Okay, so with that, and there's many other clips, each of the modules have several video clips as part of it. We're just kind of featuring one for each module to give you a sense of what they look like, what the content is, but I encourage you to please check out the video library and look into other ones. I love the videos as part of this course. I think they're really engaging and well done, and I encourage you to kind of use them as you're messaging the value of this course to others. So let's talk a little bit about how this Module 2 might align with priorities or existing initiatives in your schools. So as I mentioned, you may have trainings or initiatives supporting mental health literacy and reducing stigma. So I'd love to hear about those and how they might intersect. And as you're adding into the chat some of your thoughts about that, for me and for one another, I do want to touch on youth mental health first aid to address Bob's direct question. And we get a lot of questions about youth mental health first aid and kind of how that intersects with Classroom-Wise. We know that many schools and districts are starting to adopt youth mental health first aid. And we positioned it here because it really is aligned with Module 2 specifically. And so we want to talk a little bit about what it is, and then we can talk about how it varies from Classroom-Wise. So Youth Mental Health First Aid is an 8-hour public education course, and it trains participants on how to identify, understand, and respond to signs of mental illness and substance use disorders in youth. So it is fairly disorder specific in some ways, like it talks about signs and symptoms of specific types of mental health conditions that you would want to keep an eye out for, and kind of what's within, for quote, typically developing range, and then what would be kind of out of the range that we would start getting worried about. It does emphasize the importance of early intervention and how to approach and refer an individual youth in crisis or a youth who's kind of contending with mental health concerns. It's designed for adults primarily who work with youth. So this could be any adult. It would include teachers as an audience member and school staff as an audience member, but it's also designed for other adults that interact with youth, like coaches, camp counselors, youth group leaders, for example, with churches, and Boys and Girls Club members, teaching staff with that group, as well as parents. So it is appropriate for school staff, certainly, but it's not designed specifically for the school context, the school setting, or a school staff audience. It is at cost, which some of you may know if you're familiar with Youth Mental Health First Aid. It's not free, it's not in the public domain, and it's not, to my understanding, and folks can correct me if I'm wrong, it's not self-paced. Like you either need to get a Youth Mental Health First Aid trainer in for a full 6 hours and kind of have all of your learners convening at that time to be trained by a youth mental health first aid trainer. I think now with the pandemic, they are offering a little bit more flexibility where you can do some portion of it online and then some portion of it with a trainer, and there may be some virtual attendance options for that. But to my understanding, it's not a self-paced course in that you need to have interaction with a youth mental health first aid trainer to actually receive the training. So that's a little bit about kind of what youth mental health first aid is, and I just want to open it up and see if folks have other questions, comments, clarifying things about this resource as it pertains to classroom-wise or how they may align for you. No worries, Bob. And let us know, feel free to unmute and share aloud. I don't know if folks are, if you're planning on or already have scheduled youth mental health first aid for the upcoming school year, you know, how does that influence kind of your thinking around classroom wise? We'd love to hear from you all. If there are folks in the audience who are already kind of enjoying youth mental health first aid and see it as part of the upcoming school year, you know, what are your thoughts on on whether it makes sense to adopt classroom wise as something complementary, or how that would even work so that you don't overburden your teachers with too many hours of professional development?
Yeah, so I'm like therapist in the school, like through a grant. And that's kind of my thing is like, I don't want to like overwhelm the teachers with with too much stuff. So like I'm trained as a trainer to train them in youth mental health first aid, but at the same time, they already have like training that they have to do with the school. And I feel like that's just kind of like overkill. And I want them to still be on board with what I'm trying to do with them. So I feel like that's a little bit of a barrier.
Absolutely, Ashley. And what an incredible resource to have a youth mental health first aid trainer right in their school building. So I think that's something to think about as well. Like maybe for your teachers, for example, you wouldn't want to not train them in youth mental health first aid because that's expertise that you have in your, right? And your district has invested in you to be able to be that resource. You know, so I think where you have sort of logical connections and supports around youth mental health first aid, I mean, it's an outstanding resource. Tara Koch, who's usually with us, she's at the Southeast MHTTC. She's also a youth mental health first aid trainer, and many other members on our team are as well. And I know it's just a really outstanding resource for a lot of schools. So I think it's for individual teams to kind of grapple with. I mean, my understanding is that youth mental health first aid is going to go much deeper into kind of these elements that we talked about in Module 2, like you can't compare an 8-hour course to a 1-hour self-paced module, right? Like you're obviously going to get a lot more depth with youth mental health first aid. I think classroom-wise might offer a little bit more breadth in terms of some of the other modules that are offered and specific classroom strategies and really being school-oriented and in the public domain. So I could see them kind of being a nice companion, but you'd have to think about what's the timing that we're asking teachers to do this, because doing 5 hours right after doing 8 hours might be too much. So maybe if you do youth mental health first aid, let's say you're always doing that at back to school, maybe the classroom wise is a nice mid-year refresher if they've got some PD hours or, you know, PD days throughout the year to kind of refresh and augment what they've learned. I mean, I think there's no right or wrong answer here, right? Like but it's a matter of, for you all that are in these leadership and training positions to understand the specific content of both, because if you don't understand the content, then it's kind of hard to do that alignment piece, right? So it's about content alignment as well as just the realistic issues of timing and logistics. Oh, June, thank you for weighing in. So she's saying as a youth mental health first aid instructor, I see both as excellent resources, but classroom-wise, providing more practical strategies for teachers. Youth mental health first aid is offered virtually and blended with some self-paced and some instructor-led. Thanks for weighing in, June. So there has been some variations on that. It's great to see that there's some flexibility in taking that course. So yeah, and it looks like Bob's saying too, like the classroom-wise aligns with classroom management PDs that I do. And I will tell you, like, I have another project where we do some trauma-sensitive classroom work, and I train teachers on social-emotional learning strategies that are just practical stuff they can use in their classroom. And it's very much aligned with actually what's in Module 3. So there may be some efficiencies for those of you who already do training with teachers and you kind of do your training every year. there could be efficiencies in asking people to like, hey, do this classroom-wise module, and then we can talk about it, and then we can meet about it, and we can talk about applications. It could potentially take the burden off some of you who are doing a lot of PD on trauma sensitive or kind of some of these general tier 1 stuff to say, take classroom-wise, and then we can have a conversation about it. So that's kind of another idea to put in the back of your head about, you know, what are some of the best ways to leverage these resources. You could also, if you like doing the PDs that you're already doing, you could include any of the videos or resources and use that to complement your work, right? So you could show any of the videos on the video library as part of your PD. So there's no right or wrong way here. What we're hoping to do from the Southeast standpoint is help you really understand the resources that are available and think through how can you integrate that? How can you fit that so that it's value added to what your teachers are receiving, but in a way that just doesn't feel like an extra thing, right? So and that's kind of the purpose of the office hours, is we're going to be diving into each of the modules so you can think through those pieces. Absolutely, Bob, and as a follow-up reinforcement. So this is like great booster training kind of stuff. Also, if you've got teachers coming on board later in the school year, right? Think about how much they miss in terms of retraining and PD. So thinking about people who are coming on board, maybe as first-year teachers, second-year teachers, turnover that may happen throughout the year. Classroom-wise could also be a way to kind of get them up and running and up to speed with some of the mental health components. So I think all of these are great ideas, and anytime a free resource like this comes out, we just got to be really creative about what's the best way to utilize it to our benefit. Okay, I'm checking the time, so I'm going to get us through to the evaluation here in a couple minutes, and then any other questions you have, please keep them coming. We talked about this already. Here are some ways that Classroom-Wise adds value to some of the things existing on the marketplace. And so you can refer back to this if you need. And again, this is what I was just referring to, is kind of the implementation planning considerations. And I think as we are hearing more from you all in the field throughout the summer, and we're holding these office hours, we're going to continue generating more ideas like this about how Classroom-Wise could be implemented, you know, how the uptake of this makes sense. You'll want to think about, for example, if you choose like, okay, we're going to do Classroom-Wise, we want to do these 6 modules, here are some things to think through. There's kind of the initial viewing of the modules. So you'll have to decide, is this something we're going to suggest? Is this something we're going to require? Am I going to require teachers to send us their certificates of completion, for example? Are we going to build it into their PD days in the calendar? Or is there some other protected time? I know some school districts actually have online self-paced PDs that are kind of loaded up for summer viewing, and teachers receive some pay over the summer to take those courses before they come back to their preschool planning. So you all kind of know the intricacies of your PD calendars and requirements, but thinking about how to build in time for the actual viewing of those modules kind of would be your first order of business. And then we really encourage you to think about supported application, what you can do on the ground to help teachers talk through and have discussions around how they would apply these modules, what they liked, what they didn't like, what they're going to try out. You may have in-house consultation or coaching support. So for those of you on the call, I know many of you do consultation and coaching in your classrooms because that's your role as a mental health professional. So these are all ways that the mental health team or the administrative team can help teachers have conversations and walk through kind of applications of this after viewing the module. I encourage you to think about your natural mechanisms for peer support and shared learning. If you've got grade level meetings or professional learning communities, those can be great mechanisms to say, you know what, this week we're going to talk about modules 1 and 2. What did you guys see from Classroom-Wise that you like? What do you want to trial out this week? And it could be a matter of, 15-minute check-in by a mental health professional that drops into that grade level meeting. So you've provided some accountability for the teachers taking it, but you're also offering an opportunity to discuss, and the mental health provider as a resource. Again, this is not like required, but these are some things that we're thinking through in terms of actually making sure these strategies can be implemented and used in the classroom. And we know, all of us as adult learners, we can see all these beautiful examples when we view the modules, but if it's not part of our routine practice right now, we're probably going to need a little bit of discussion or supported application to make it happen. And there are many of you here on the call that represent a whole range of multi-level stakeholders. Your roles and responsibilities are going to vary with classroom-wise implementation, just like any other implementation you do. So I encourage you to think about how you can share the workload and what are the specific roles and responsibilities that each person could play in your system to support this. So it's not just, you know, we're requiring teachers and now it's their job to do it, and we're sort of, that's the end of everyone's responsibilities. We're going to be diving a lot more into implementation planning considerations at the very last office hours of the summer, which is a little bit longer. And we'll also be sharing out what we've heard over the summer in terms of how other schools are looking to implement. So stay tuned for us to lean into this piece a little bit more. Please know that there are additional resources on ClassroomWise. This is an outstanding 2-page resource that you can access, so I encourage you to find it. Sarah just put in the 2-pager link, so please pull that up and send it to your colleagues. There's also a course description that you can locate right on the homepage of ClassroomWise. So if you're looking for just kind of a 1-pager, what's in this resource with all the modules contained, that's another good sort of go-to place as you're doing some of these discussions about alignment and so forth. So with that, I welcome you to share additional questions in the chat over the next several minutes. These are upcoming office hours supports. Nancy Lever will be joining you next Tuesday to dive into Module 3. So if you're curious about how Module 3 may align with SEL, please join us next week. We're going to be talking about the partnership that existed with CASEL to develop Module 3 and really diving into the kind of the SEL pieces. And then we have upcoming office hours for the following modules, followed by a 90-minute session on August 10th, where we bring it all together and really focus on implementation. So with that, I want to hand it over to Andrew to tell us a little bit about the evaluation.
Yeah, I'm going to tell you guys about the evaluation.
Oh, great. Sorry, Andrew. Go for it, Sarah.
No, you're fine. So as part of receiving SAMHSA funding, we are required to submit data related to the quality of this event. We ask that you please take a moment to complete a very brief survey about today's session. After you complete this survey, you will be redirected to a second survey that includes additional information our center likes to collect to continue to improve the quality of our trainings and make sure we are addressing the needs of stakeholders in our region through our programming. We greatly appreciate it if you would take the opportunity to complete this survey.
So I know our team will put that survey link into the chat. Please take a couple of minutes to do that. It really means so much to us and to SAMHSA when we can capture your feedback. And that's concludes today's presentation. We are so grateful for your participation, for your feedback. That's what this office hours is designed for. We want to hear from you in the field and get all of your questions and good thinking about this resource and how it applies for you locally. So we hope to see you back here next week, and we wish you an outstanding rest of your day.